Hi guys, Dr. Amy Crane here, and I want to talk to you guys today about low back pain, but specifically low back pain due to arthritis in the spine. Now there's many different reasons why we can get arthritis through the spine, but today I want to talk to you guys about postural changes and mobility issues that tend to lead to that arthritis. So we have three different curves in our spine. We have the same curve in our neck and our low back, and the opposite in our thoracic. So for the low back, we want this C-shaped curve in the spine. If not, when we start to straighten out, what happens is the spine can't absorb as much compression force, but then also the center of gravity and weight bearing shift changes. So when we lose that curve, the weight starts to shift forward and down, and it starts to be carried on that disc in the spine and creates more wear and tear over time, which can lead to that arthritis. So by taking an x-ray, we can see, do we have any of that structural change that is technically phase 1 of degeneration now? Now phase 2 is when we actually start to get some of that arthritis that forms. Now what that looks like is, if you can see in this picture, there's this disc here is decreased compared to the ones above and below it. And now what that means is that disc isn't absorbing as much of that compression force anymore, and more of that stress is getting put on the bones. So we start to get some of that pointy edging that starts to form because that disc can't absorb anymore, and we start to get bone spurs that start to form. Now that's permanent change that we can't do anything about, so we really want to know if we have any of that in the spine already, because we want to make sure that we try to maintain what we have so that it doesn't get any worse. How we do that is making sure that these vertebrae are moving properly to pump nutrients in and out of that disc to make sure that we maintain what we have left. Because once we start to get arthritis in one area, chances are it's going to start to go above and below, and that's when we start to get into phase 3, because joints move in two. So if these two bones are really locked up, well, chances are the ones above and below are going to start to get affected as well. So this spine model kind of shows you how healthy this disc looks compared to this disc. So we want to make sure that we're not in that phase 2 or phase 3, and if so, we need to know if we are and what we need to do to make sure that we don't get any worse. Okay, so if you guys have any questions regarding any of the arthritis and degeneration that I'm talking about, please comment below and we'll get back to you as soon as we can. If not, if you found this useful information, please like or share the video so that others can maybe get the information as well. Thank you guys, and have a great day.